Healthcare groups use data for lots of different reasons: to find population trends and needs, to plan services, to track correlations between health and lifestyle, and to target healthcare research. At the Open Data Institute, we see the value of data in research and how it could be used to help improve healthcare in the UK. So we're working with the National Institute for Health Research to help them make data about their funding of health research more open for anyone to access, use and share while respecting privacy. So we hope that this will help save time and money by streamlining processes and also encourage researchers and data experts to innovate with the data to identify trends, gaps and drive improvements.
Well, there's a wealth of data about the many ways the NIHR funds and supports health research, but much of it is siloed, locked away in systems which makes it hard to access and monitor. For our internal teams at NIHR, this makes it hard to do things like respond quickly to parliamentary questions or freedom of information requests. For our external audiences like researchers and funders, it's hard to see the scope and scale of the research we fund, or spot trends and gaps. Data and tech experts can't access the data in standardised formats, which can stifle innovation. Providing the data in an open, accessible platform will not only make internal processes more efficient, but will also allow external audiences to access data directly without the need to make individual requests to our team.
So at the ODI, we work with companies and governments to build an open, trustworthy data ecosystem where people can make better decisions using data and manage its harmful impacts. So we support practices that increase trust by building ethical considerations into how data is collected, managed and used, by ensuring equity around who accesses, uses and benefits from that data, and by engaging affected people and organisations. Publishing data for anyone to access, use and share while respecting privacy demonstrates transparency and accountability. In practical terms, it also streamlines processes, creating resource and budget savings. Along with giving advice, training and practical support to NIHR, we've also helped them think through their requirements for a data publishing platform. They've ended up choosing Open Datasoft, which is robust, user-friendly and offers visualization and monitoring tools.
We want to centralise our datasets and publish data more openly and efficiently. We've started by looking at our most requested dataset, the funded portfolio. This dataset includes all funded research since 2011, including titles and abstracts of awards, funding awarded, funding streams and recruitment numbers. Requests for this come from internal staff, researchers, government, the media and the public, and we spend a lot of time responding to them. The dataset is already held centrally, it's robust and so is a great candidate to make open and showcase the benefits. It'll also help streamline responses to information requests and ensure that the data we use in reporting is high quality and well structured at its source.
In September 2012, ODI member NHS Digital started to publish prescribing data from UK GP practices under an open government licence. The data contains information about individual drugs, such as names, quantity, strength and cost, but not individual prescriptions or data that could be used to identify patients. The ODI helped to analyse the data and found that nearly £27 million per month could be saved by the NHS if GPs switched from prescribing branded drugs to generic drugs. In another example, Carlisle City Council received about 75 requests for information about business rates each year. It cost the council hundreds of pounds to process each request. They found that making this data open and automated could help save at least £15,000 a year and improve the service for people making the requests. With this data open for anyone to access, use and share, other groups can also use it to create apps and services and build stronger relationships with the council.
We want to publish NIHR funding data openly to help improve health and care research outcomes. Next, we'll look at other datasets with a high value that can be published to improve more services and streamline internal processes. We look forward to a continued partnership to drive the next stages of open data publishing in health research.